Hi, I'm Dr. Stephanie Teal, and I'm an OBGYN at New York Presbyterian Hospital. You're probably watching this video because you've asked about Mirena, or because your doctor thinks Mirena may be right for you. As an OBGYN, I understand that choosing a birth control method is a very personal decision. I've prescribed Mirena for many of my own patients, and I've seen how satisfied they are. Today, I'll be talking to some women who are making decisions about their own birth control needs and answer some of the same questions you may have. First things first, this is Mirena. The T-shaped frame is made of soft, flexible plastic, and it's about the size of a quarter. Mirena is an advanced form of long-acting birth control that's placed in the uterus and releases very small amounts of hormone. Once your doctor places it, Mirena prevents pregnancy for 5 full years, or until you decide to have it removed. There's no single explanation for how Mirena works to prevent pregnancy. Once inserted, it thickens your cervical mucus to prevent the passage of sperm, inhibits sperm movement, and thins the lining of your uterus. We're not sure which action is most important for preventing pregnancy, but likely they all work together to make Mirena over 99% effective. That's more effective than the pill, condoms, a diaphragm, or a sponge. And Mirena gives you that reliable protection without any extra hassle. There's no daily routine required. That's just one of the benefits that makes Mirena a good birth control option for busy moms like Carrie.
I cannot believe number 2 will be here so soon.
I know. I'm gonna have my hands full.
Oh, yeah, wait until you have 3.
Oh, no. I think this is it for us for a while anyway.
You know, you want to ask your doctor about Mirena.
You think so?
Definitely. I love mine. Nothing to think about, nothing to remember. I've been using one ever since we had Katie.
Well, I know I don't want to go back on a pill. I could barely remember to take it.
Trust me, with 2, you'll be lucky if you can remember your own name. I hardly ever think about my Mirena. You pretty much get it and forget about it.
Sounds good.
Well, everything looks good. I'll see you again in 3 weeks, and then you'll be close to delivery.
Oh, I am so ready.
Any questions?
Not about the baby, but a friend of mine was telling me about Mirena. I know it's a little early, but...
You know, it's never too early to think about your options. With your healthy history, Mirena may be right for you.
Well, it's just that life was so crazy when I first had Anna. I just want something easier, and, well, Mirena, it just sounds like it's made for me.
Well, it is simple to use. If you decide Mirena's the right option for you, we'll evaluate you during your postpartum visit, and if there are no other considerations, we can insert it right then.
Do I need surgery?
No. Inserting Mirena is a simple in-office procedure with minimal discomfort. You may experience some cramping, like menstrual cramps, and once it's in place, it's effective for 5 years.
5 years?
If that's what you want. Or if you decide to become pregnant again, just make an appointment to have Mirena removed, and you'll return to your natural state of fertility.
Wow, sounds like the best of both worlds.
Mirena's effectiveness and low maintenance make it a viable birth control option for lots of different moms. Mirena's already been used by more than 2 million women for over 10 years in Europe. And because Mirena offers both reliable protection and flexibility for the future, it's great for first-time moms, experienced parents, or moms who feel they've completed their families, like Kate.
Hey, honey. Hi, Mom. No, you were on caller ID. That's so funny. I just saw Lisa and her new little one this morning. Adorable, like all her babies have been. Well, not as cute as mine. Mom, I can honestly say it did not make me want to have another one. Actually, Kyle and I are really talking about me getting my tubes tied. Well, you did. I just think we're finished. You know, we both always said we only wanted 3. So I'm pretty sure, I think. I have an appointment to talk to Dr. Teal, so I'll see what she says. I just want to be certain, you know. Okay. Love you.
No, good report. Everything normal.
Great.
You said you wanted to talk about tubal ligation.
I've been thinking about it for a while now. Kyle and I both feel our family's the perfect size, so getting a tubal seems to make sense.
Tubal ligation is effective, but it also requires surgery. And are you sure you don't want more children?
Most days, yes. But then a little voice says, who knows?
Well, you do have other options. You could consider Mirena. It's long-term intrauterine contraception that lasts for 5 years.
So I get the benefits, but can still change my mind if I want to.
Right. Generally, tubal ligation is considered permanent. Although it can be reversed in a small percentage of patients, results are unpredictable and there is no guarantee.
I hate the idea of surgery.
Reversal is also expensive and is rarely covered by insurance. With Mirena, if you decide you want more children, you just have it removed and you'll return to your natural state of fertility.
So what's the catch? Do I need monthly checkups?
No, you just make a 3-month appointment for a follow-up visit after it's inserted, and then just your yearly exams.
Can I still use tampons?
Absolutely. And if you have any questions or concerns, just call me.
That's it?
That's it.
That's great.
There's no question that having children will alter your life. But when it comes to your birth control, you shouldn't have to compromise or sacrifice. As your lifestyle changes, the same old methods might not be right for you. Especially when you're a new mom adjusting to life as a family of 3 instead of 2, like Jenna.
Is he asleep?
Oh, please, oh, please, oh, please.
That song works every time.
Yeah, all 7 verses.
Hello.
I remember you.
And we're alone.
Let me go get my diaphragm.
Oh.
You want another one?
Go. Hurry.
2 minutes.
Perfect.
So, how's the baby?
Oh, he's fine. I'm fine, and I think Brian's fine. Well, we're not getting a lot of alone time, though. I know I just got my diaphragm fitted, but it's such a hassle. Maybe I should go on the pill, but that seems like a hassle, too.
You know, you could consider Mirena.
Well, I just read about Mirena. It gets put inside, right?
Right. It's placed directly into the uterus, where it releases the hormone right where it's needed to prevent pregnancy.
So there's nothing to stop and think about.
Neither of you will feel it. You won't even know it's there.
Well, that sounds liberating. But is it expensive?
No. In fact, over the course of 5 years, Mirena is as or more economical than any other form of birth control.
Even better.
The patients I've prescribed Mirena for all have different needs, but they do have a few things in common. They've all had at least 1 child, they're all in committed relationships, and none of them have any history of or risk for pelvic inflammatory disease or ectopic pregnancy. Remember, only your healthcare professional can determine if Mirena is right for you, so make sure you discuss your complete medical history. You should also ask about the potential side effects of Mirena, such as ovarian cysts and changes in your menstrual cycle, such as missed menstrual periods, irregular bleeding or spotting for the first 3 to 6 months, and shorter, lighter periods thereafter. One of the reasons Mirena works for so many women is that it works with a variety of lifestyles and stages. Kim has had her Mirena for about a year. As a career woman, she's really focused on making time for both her family and her work. Mirena helps give Kim that freedom.
Hey, Kim, before we get going, I hate to ask, but do you have any tampons?
Oh, I don't know. I'll have to check.
Okay.
Since I got Mirena, I barely needed them.
At all?
Not really. The first few months I had some spotting between my periods, and then my periods got shorter and lighter, and now I don't get them at all.
Oh, but is that normal?
Yep. My doctor says it happens to about 20% of Mirena users after about a year or so.
A year? Have you had yours that long?
Yes. And believe me, it's the best. I'm definitely going to keep using it for at least another year, Or until I make regional manager.
Nice. Then maybe I'll get another niece.
Maybe a nephew.
Well, you look great, and your exam went well. Are you still happy with your Mirena?
Couldn't be happier. I haven't had my period in months, but you said that was normal.
Completely. You see, as Mirena suppresses the growth of your endometrial lining, you have less or nothing to shed. It's not harmful in any way.
What about when I want to get pregnant?
All you have to do is make an appointment to have your Mirena removed, and your monthly cycles will resume.
Will we have to wait before we start trying?
No, you'll go back to your original state of fertility, and you can try to get pregnant immediately. 8 out of 10 women who've used Mirena conceive within the first year after its removal, about the same rate as women who haven't used any birth control at all.
Well, I'm not ready yet, but you'll be the third to know.
The decision to use Mirena, like any form of birth control, is a big one. I hope this video has helped answer some of your questions. It may even have brought up a few you hadn't thought of before. Either way, make sure you discuss all the issues with your healthcare professional to find out if Mirena is right for you. For more details, ask your healthcare professional for the Mirena Patient Information Brochure. Your contraceptive needs are important, and you need a solution that really works for you. Mirena may be the option you've been waiting for.